dissection of the front of the leg. The skin incision has been made from the upper part of the front of the leg, then it has been extended along the middle of the leg till the middle of the ankle region. Then it has been extended further along the dorsum of the foot up to the middle of the second toe. Then after reflecting the skin has been reflected. After reflecting the skin, on the medial side, we can see the saphenous nerve. This nerve is the saphenous nerve. It is piercing the fascia lata at the posterolateral part of the knee. Then it comes along with the great saphenous vein. This vein is the great saphenous vein. So saphenous nerve runs along with the great saphenous vein all along the course. Then it comes downwards. Then it reaches the medial side of the foot. Then in the lateral side, we can see the superficial peroneal nerve. This nerve is the superficial peroneal nerve. It is piercing the deep fascia at the junction of the upper 2/3 and middle 1/3 of the lateral side of the leg. Then the superficial peroneal nerve divides into medial branch. This is the medial branch of the superficial peroneal nerve, which comes to the medial side of the foot region. Then some intermediate branches which reaches the lateral side of the dorsum of the foot. And after seeing the superficial nerves, we can see the deep fascia. So this fascia is the deep fascia. This fascia has been cut longitudinally in between the tibia and the fibula. Then it has been reflected. This blob reflected medially and this blob has been reflected laterally. Then deep to that, we can see the muscles of the anterior compartment of the leg. This muscle is the tibialis anterior muscle, which arises from the lateral surface of the tibia. This muscle is the extensor digitorum longus muscle, which arises from the medial surface of the upper part of the fibula. Then below that, we can see the extensor hallucis longus muscle. This muscle is the extensor hallucis longus muscle, which arises from the medial surface of the middle part of the fibula. Then below, we can see the peroneus fascia. This muscle is the peroneus fascia, which arises from the medial surface of the lower 1/4 of the fibula. So these are the muscles of the anterior compartment of the leg. So once you separate the muscles, deep to that, we can see the deep peroneal nerve. This nerve is the deep peroneal nerve. So this is the deep peroneal nerve. This deep peroneal nerve pierces the extensor digitorum longus muscle. This is the deep peroneal nerve pierces the extensor digitorum longus muscle, then comes to the anterior compartment. Here it lies lateral to the tibial vessel. So these are the tibial vessels. So this is the anterior tibial vein and this is the anterior tibial artery. So the deep peroneal nerve lies lateral to the tibial vessels in the upper part of the leg. Then it comes and reaches the anterior part of the extensor hallucis longus muscle. This is the extensor hallucis longus muscle. Then it reaches anterior to the extensor hallucis longus. Then in the middle of the leg, it lies in between the extensor hallucis longus and tibialis anterior. This is the extensor hallucis longus and tibialis anterior. Here you can see the deep peroneal nerve. This glistening white thing is the deep peroneal. So this nerve is the deep peroneal nerve. It lies between the extensor digitorum, extensor hallucis is longest and tibialis anterior. Here the tibial vessel, anterior tibial vessel lies posterior to the deep peroneal nerve here. So these are the tibial vessels which lies posterior to the deep peroneal nerve. Then in the lower part of the pterygium, it lies in between the tendon of the extensor hallucis longus. This is the tendon of the extensor hallucis longus, and this is the tendon of the extensor digitorum longus. So in between the tendon of the extensor hallucis longus and extensor digitorum longus, this deep peroneal nerve lies here. So this is the deep peroneal nerve. It lies in between the tendon of the extensor hallucis longus and extensor digitorum longus here. This is the deep peroneal nerve. So here the vessel lies lateral to the deep peroneal nerve. Here the vessel lies lateral to the deep peroneal nerve. This is the anterior tibial vessel lies lateral to the deep peroneal nerve in between the tendon of the extensor hallucis longus and extensor digitorum longus. This is the various position of the deep peroneal nerve in relation with the muscles of the anterior compartment of the leg. So here in the upper part, the tibial vessel lies in between the extensor digitorum longus and tibialis anterior, and here it lies lateral to the medial to the deep peroneal nerve here. These are the tibial vessels. Then in the middle part of the leg, the tibial vessel lies posterior to the deep peroneal nerve here. So this is the deep peroneal nerve. Here it lies posterior to the deep peroneal nerve. These are the tibial vessels. Then in the lower part of the leg, that is here the ankle region, they lie in between the tendon of the extensor hallucis longus and extensor digitorum longus and lateral to the deep peroneal nerve. So this is about the position of the tibial vessels in relation with the deep peroneal nerve and the muscles of the anterior compartment of the leg.